I'm Dr. John McDougall, and I'd like to talk to you a bit about cholesterol. Cholesterol is a risk factor. In other words, it's one of those things we rely upon to help us understand the health of our arteries. It's a risk factor tied to artery disease. The higher the cholesterol, the more likelihood that you have artery disease like strokes and heart attacks. The first thing you need to understand is that cholesterol comes from animal foods, eggs, dairy products, all kinds of meats and fishes. And when you eat that kind of diet, what happens is you develop high cholesterol in the body. And the body has an ability to get rid of cholesterol, but only the amount that it makes itself. We're an animal, we make cholesterol. When we take in additional cholesterol, the body cannot process that out of itself efficiently. As a result, it stores that cholesterol in our skin, in our tendons, and in our arteries, and it causes blockages. But if you eat a high starch diet, one that's virtually free of cholesterol, you're not going to have a heart attack. It's extremely unusual for somebody to have a heart attack that follows. And we're talking about studies of populations of millions of people where heart disease doesn't exist when they're living on a starch-based diet. Now, you might think to yourself, well, I can solve my cholesterol problem. In fact, there are quite a few of my patients used to come in and say, I don't have any health problems. And I'll say, you're taking cholesterol-lowering medication. Well, I used to have a cholesterol problem. It's solved now. The truth of the matter is we do have very powerful drugs. They're called statins that do lower the cholesterol level. But hell, dying with a low cholesterol is not what you want to do. What you want is you want results that show you have a reduced risk of stroke and heart attack. That's what you're interested in. You don't want to die. You don't want to have these major illnesses, the debilitating illnesses. That's what you're looking for. Now, even though the numbers you can be changed drastically with statin drugs, the results that you're looking for are minimally benefited. How minimally benefited are they? Well, it's May 3rd, 2022. And if you look at the issue of the Journal of American Medical Association that just came out, they talk about the absolute risk reduction of having a heart attack or stroke by taking powerful statins as recommended. And the risk reduction is around 1%. In other words, almost nothing. Now, of course, they lie to you by talking about relative risk reduction, but you want to know something called absolute risk reduction. So knowing this, I think very few patients would take statin drugs. You know, I prescribed them up until recently in my very ill patients who've had a history of heart disease, heart surgery, strokes. These people are at very high risk of having another problem. I felt it's worth a while to put them on statin-lowering medications. But, you know, I share this May 2022 Journal of the American Medical Association article with my patients. So they're going to say, I don't think I want to take the risks. You know, I don't want to risk having rhabdomyolysis, which is where the muscles are damaged, sometimes to the point of dying. 10% of people to the point of pain. They get painful muscles. About 70% of people, if you look at them in terms of biochemical changes, those on statins, about 70% of them will show damage to the muscles. People say, you know, that and a few other serious associated adverse effects of these medications, and the cost, and also the fact that you're now drug dependent. You got to take this medication every day for the rest of your life, and you do. It's not just for a temporary period of time; it's for the rest of your life. You say, "Boy, if it's just a 1% absolute reduction, oh, I'm not going to take it. It's not worth my money, not worth my time, not worth the risks." And so you'll find me in the future recommending fewer and fewer of my patients take these statin drugs. As the data comes out, it becomes clear. Of course, this is a number one business in the country is selling these statin drugs for the drug companies. So it's going to be a tough sell. They're going to get their spin doctors out there and try and convince you by lying to you, telling you about the relative risk reduction rather than the absolute risk reduction. And most people will end up, unfortunately, buying into it. You know, one other thing I want to add before I stop this conversation is when I take care of a patient and I hand them a prescription for statin drugs, I worry that they're thinking, well, Dr. McDougall, If you really believed in your diet, you wouldn't be giving me this prescription. And there's some truth to that, I guess. They have a right for saying that. But I really do believe in the diet. Sometimes I worry that you're not going to follow the diet. That's probably why I prescribe them in some cases, is I worry you're not going to follow it. But if you follow the diet, you should expect tremendous benefits, far in excess of anything you'd ever get from taking a pill. No cost. It has so many positive effects. You lose excess body weight, your blood pressure comes down, blood sugar comes down, you get off your blood pressure medication, your diabetic medication. It's a win-win situation for everybody except for the drug companies and the food companies and the hospitals, etc. But I just care about you. I just care about the patient. I'm Dr. John McDougall. Thank you for listening to me.